Lung cancer symptoms. Lung cancer is a type of cancer that begins in the lungs. Your lungs are two spongy organs in your chest that take oxygen when you inhale and release carbon dioxide when you exhale. Lung cancer is the leading cause of cancer deaths worldwide. People who smoke have the greatest risk of lung cancer, though lung cancer can also occur in people who have never smoked. The risk of lung cancer increases with the length of time and number of cigarettes you've smoked. If you quit smoking, even after smoking for many years, you can significantly reduce your chances of developing lung cancer. Causes of lung cancer. Smoking causes the majority of lung cancers, both in smokers and in people exposed to secondhand smoke, but lung cancer also occurs in people who never smoked and in those who never had prolonged exposure to secondhand smoke. In these cases, there may be no clear cause of lung cancer. How smoking causes lung cancer. Doctors believe smoking causes lung cancer by damaging the cells that line the lungs. When you inhale cigarette smoke, which is full of cancer-causing substances or carcinogens, changes in the lung tissue begin almost immediately. At first, your body may be able to repair this damage, but with each repeated exposure, normal cells that line your lungs are increasingly damaged. Over time, the damage causes cells to act abnormally and eventually cancer may develop. Types of lung cancer. Doctors divide lung cancer into two major types based on the appearance of lung cancer cells under the microscope. Your doctor makes treatment decisions based on which major type of lung cancer you have. The two general types of lung cancer include small cell lung cancer. Small cell lung cancer occurs almost exclusively in heavy smokers and is less common than non-small cell lung cancer. Non-small cell lung cancer. Non-small cell lung cancer is an umbrella term for several types of lung cancers. Non-small cell lung cancer includes squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Symptoms of lung cancer. The early symptoms of lung cancer may be a slight cough or shortness of breath, depending on which part of the lung is affected. As the cancer develops, these symptoms may become more severe or intense. Like many other types of cancer, lung cancer may also cause systemic symptoms like loss of appetite or general fatigue. Early warning signs of lung cancer. Most lung cancers don't cause symptoms until the disease has advanced, in part because the lungs have very few nerve endings. When lung cancer does cause signs in its early stages, they may vary from person to person, but commonly include a new cough that is persistent or worsens, or a change in an existing chronic cough. Cough that produces blood. Pain in the chest, back, or shoulders that worsens during coughing, laughing, or deep breathing. Shortness of breath that comes on suddenly and occurs during everyday activities. Unexplained weight loss. Feeling that you're tired or weak. Loss of appetite. Lung infections such as bronchitis or pneumonia that won't go away. Hoarseness or wheezing. Less common symptoms of lung cancer may include swelling in the face or neck, difficulty swallowing or pain while swallowing, changes in the appearance of fingers called finger clubbing. Although most of these symptoms are more likely to be caused by something other than lung cancer, it is important to see a doctor. Discovering lung cancer early may mean more treatment options are available. Advanced lung cancer symptoms. Advanced stages of lung cancer are often characterized by the spread of cancer to distant sites in the body. This may affect the bones, liver, or brain. As other parts of the bodies are affected, new lung cancer symptoms may develop, including bone pain, swelling of the face, arms, or neck, headache, dizziness, or limbs that become weak or numb, lumps in the neck or collarbone region. Non-small cell lung cancer symptoms. Non-small cell lung cancers, or NSCLC, may grow slowly over a period of time before symptoms develop. Common NSCLC symptoms include persistent coughing, particularly without any known cause, a cough that produces blood or red-colored phlegm called hemiptosis, chest pain or painful breathing, difficulty breathing or shortness of breath, fatigue or feeling unusually weak or tired, hoarseness or wheezing, frequent upper respiratory infections like bronchitis or pneumonia, bone pain. Other areas of the body may be affected by either the spread or development of NSCLC tumors. Neurological changes. Lung cancer may spread or metastasize to the brain. This may cause headaches or even seizures. Numbness or weakness in the arms and legs may occur if a large tumor begins to press against a nerve. Lumps. In advanced stages, the cancer may spread throughout the lymph nodes. Sometimes tumors near the skin surface may appear as lumps. Horner syndrome. Tumors may possibly cause nerve damage. Horner syndrome is a particular set of symptoms associated with the nerve damage. The symptoms often affect one side of the face, causing a droopy eyelid and a reduction in the size of the pupil, the dark center of the eye. Paraneoplastic syndromes. Cancer cells may make chemicals that trigger other reactions, which are collectively referred to as paraneoplastic syndromes. Symptoms may include high blood calcium levels or hypercalcemia, excess bone growth, or blood clots. Small cell lung cancer symptoms. Most of the signs associated with small cell lung cancer or SCLC are not present until the cancer has progressed. Typically, symptoms of SCLC continue to evolve and worsen as the disease spreads to distant organs. Early symptoms of SCLC: persistent cough, chest pain that gets worse with deep breathing, laughing, or coughing, hoarseness, unexplained loss of appetite and weight, coughing up blood or rust-colored phlegm, shortness of breath, feeling weak or tired, bronchitis, pneumonia, or other infections that keep recurring, and wheezing. Symptoms of advanced stage SCLC: bone pain, headaches, dizziness or limbs that become weak or numb, jaundice, lumps in the neck or collarbone region. Paraneoplastic syndromes and lung cancer. Sometimes SCLC can cause paraneoplastic syndromes. While not always the case, these syndromes are often early signs of SCLC. SCLC may cause one of the three paraneoplastic syndromes: syndrome of inappropriate antidiuretic hormone or SIAD, Cushing syndrome, or Lambert-Eaton syndrome. Symptoms of paraneoplastic syndromes include muscle cramps, muscle weakness, elevation of calcium in the blood, and clubbing, which refers to a change in the shape of fingertips. Metastatic lung cancer symptoms. Metastatic lung cancer symptoms depend on the part of the body to which the cancer has spread, as well as the size and location. Sometimes metastatic disease may not cause any symptoms, though about 30% to 40% of people with lung cancer will have symptoms of metastasis. If the cancer has spread to the bones, it may cause bone pain, often in the vertebrae or ribs. Other symptoms include fractures, constipation, or decreased alertness due to high calcium levels. If the liver is affected, symptoms may include nausea, extreme fatigue, increased abdominal girth, swelling of the feet and hands due to fluid collection, and yellowing or itchy skin. If either the brain or the spinal cord is affected, symptoms may include headache, blurred or double vision, difficulty with speech, or seizures. Risk factors. A number of factors may increase your risk of lung cancer. Some risk factors can be controlled, for instance, by quitting smoking, and other factors can't be controlled, such as your family history. Risk factors for lung cancer include smoking. Your risk of lung cancer increases with the number of cigarettes you smoke each day and the number of years you have smoked. Quitting at any age can significantly lower your risk of developing lung cancer. Exposure to secondhand smoke. If you don't smoke, your risk of lung cancer increases if you're exposed to secondhand smoke. Previous radiation therapy. If you've undergone radiation therapy to the chest for another type of cancer, you may have an increased risk of developing lung cancer. Exposure to radon gas. Radon is produced by the natural breakdown of uranium in soil, rock, and water that eventually becomes part of the air you breathe. Unsafe levels of radon can accumulate in any building, including homes. Exposure to asbestos and other carcinogens. Workplace exposure to asbestos and other substances known to cause cancer, such as arsenic, chromium, and nickel, can increase your risk of developing lung cancer, especially if you're a smoker. Family history of lung cancer. People with a parent, sibling, or child with lung cancer have an increased risk of the disease. Complications. Lung cancer can cause complications such as shortness of breath. People with lung cancer can experience shortness of breath if cancer grows to block the major airways. Lung cancer can also cause fluid to accumulate around the lungs, making it harder for the affected lung to expand fully when you inhale. Coughing up blood. Lung cancer can cause bleeding in the airway, which can cause you to cough up blood. Sometimes bleeding can become severe. Treatments are available to control bleeding. Pain. Advanced lung cancer that spreads to the lining of the lung or to another area of the body, such as a bone, can cause pain. Tell your doctor if you experience pain, as many treatments are available to control pain. Fluid in the chest or pleural effusion. Lung cancer can cause fluid to accommodate in the space that surrounds the affected lung in the chest cavity or the pleural space. Fluid accumulating in the chest can cause shortness of breath. Treatments are available to drain the fluid from your chest and reduce the risk that pleural effusion will occur again. Cancer that spreads to other parts of the body or metastasis. Lung cancer often spreads or metastasizes to other parts of the body, such as the brain and the bones. Cancer that spreads can cause pain, nausea, headaches, or other signs and symptoms, depending on what organ is affected. Once lung cancer has spread beyond the lungs, it's generally not curable. Treatments are available to decrease signs and symptoms and help you live longer. Prevention of lung cancer. There's no sure way to prevent lung cancer, but you can reduce your risk if you don't smoke. If you have never smoked, don't start. Talk to your children about not smoking so that they can understand how to avoid this major risk factor for lung cancer. Begin conversations about the dangers of smoking with your children early so that they know how to react to peer pressure. Stop smoking. Stop smoking now. Quitting reduces your risk of lung cancer, even if you've smoked for years. Talk to your doctor about strategies and stop smoking aids that can help you quit. Options include nicotine replacement products, medications, and support groups. Avoid secondhand smoke. If you live or work with a smoker, urge him or her to quit. At the very least, ask him or her to smoke outside. Avoid areas where people smoke, such as bars and restaurants, and seek out smoke-free options. Test your home for radon. Have the radon levels in your home checked, especially if you live in an area where radon is known to be a problem. High radon levels can be remedied to make sure your home is safer. For information on radon testing, contact your local Department of Public Health or a local chapter of the American Lung Association. Avoid carcinogens at work. Take precautions to protect yourself from exposure to toxic chemicals at work. Follow your employer's precautions. For instance, if you're given a face mask for protection, always wear it. Ask your doctor what more you can do to protect yourself at work. Your risk of lung damage from workplace carcinogens increases if you smoke. Eat a diet full of fruits and vegetables. Choose a healthy diet with a variety of fruits and vegetables. Food sources of vitamins and nutrients are the best. Avoid taking large doses of vitamins in a pill form, as they may be harmful. For instance, researchers hoping to reduce the risk of lung cancer in heavy smokers gave them beta-carotene supplements. Results show the supplements actually increase the risk of cancer in smokers. Exercise most days of the week. If you don't exercise regularly, start out slowly. Try to exercise most days of the week. Get expert advice and care. Understanding when symptoms are a sign of something serious and either diagnosing the disease or confirming a previous diagnosis require expertise from specialists trained and experienced in treating lung cancer. At Cancer Treatment Centers of America, or CTCA, our lung cancer experts treat all stages of the disease. In the end, make sure to share your experience with us and don't forget to subscribe, share, and like.